Dr. Petersen, as we start to wrap this up, I'm sure people listening who are relating to this information right now are wondering, where do I start? What is one question your patients should be asking when it comes to their health?
I think that the question they should be asking is why, and if they go to a clinician and they say, why could this be? And again, if they're told, well, it's genetic, well, you're a working mom, you have a stressful job. If they're being given excuses as to their health, then they're not with the right clinician. If someone can say, there's always a reason, we're going to find the reason, and they have the statistics and the long-term research to stand by that, then that's who they should be sticking with, is someone who has had a lot of experience in the field and gets results. And it's important. And one thing I'm often asked is, and I love this question, is, at the end of a lecture or someone says to me, well, okay, I just want to do one thing. What's the one thing I can do today to make a difference? And it's a very legitimate question. And I always answer it with, if there was one thing, I would be delighted to tell you what that was. But the body is an interesting thing in that it works synergistically. And very often I meet patients and they've done a thing right, or another thing right, but they just haven't done all of it, and it hasn't worked together to get that resolution. So if you're online and you see somebody says, this anecdotal story of, I did this one thing and now XYZ, symptom condition is resolved, it's anecdotal, and I'm not saying the person's not being truthful. It might have worked for them, but for how long, really, number one. And then number two, that's not the way the body works. So you want someone who can really look at all the factors, look at you comprehensively, and say, what treatments need to be done naturally to resolve your problem from the ground up, basically.